We appreciate you joining us tonight on Open Line as we talk about getting safely back to school. Our guest tonight, Dr. Amy Bono with Protect My Care. She is a primary care physician here in Middle Tennessee, here to answer your questions about getting these kids back to school. Danielle is on the line. Hi, Danielle. Thank you for being our first caller tonight.
Hey, how are you doing?
I'm doing great. Go ahead.
Well, my question is, I've seen today that the governor has released that he doesn't think that it's necessary to keep up with the cases and making it known to the public.
Okay, that's news to me. Yes, that was news to me because we did get those numbers today, but I'm not saying that's not the case.
Just my on why that he doesn't feel that it would be important to us as parents, teachers, to know those numbers.
Yeah. Okay. Thank you, Danielle, for calling in. We do appreciate it. Dr. Bono, had you heard that today?
I had not, but frankly, I kind of figured it was coming. I've been through a shutdown of my educational institution before, and I don't know a lot of data. I don't know the where, the whens, the whats, but I feel that there is a need to respect people's privacy. I think that our callers should honestly lean on the governor and ask him directly. If you really want to know the answer, well, ask your governor. Make your voice heard.
And I just want to reiterate that I don't know that is the case, because that certainly would be something that we would cover in the news. That would be a really big story. I do know, I was just listening to my district's work session board meeting before I came on. I've kind of been dipping in and out of it throughout the newscast today. And I live in Wilson County. That's where my kids go to public school there. And that is a question that has come up by parents. How will the schools address and identify when coronavirus hits in the schools, which we all know it will. It is inevitable. And how much identifying information can they and will they give out? And a lot of the talk was about doing due diligence, but also not creating hysteria. And I thought that was very interesting. So I know a lot of school districts are also grappling with how do we disseminate the information that is needed to be out there without putting out too much or not the right things. I'm sure that you have dealt with this as well as a doctor, just making sure that people get the right information.
Right. When it comes to part of the plans, as I've dealt with my educational institution, I do feel that when, you kind of define when you can come back to school, and there's this whole 10-day sick window, and then there's the 14-day quarantine window. Without a specific example, I don't know that I could get into a lot of details about how that could work out. Honestly, I think you need to take a big step back and say, should we really be going back to school right now? Okay. Because some of this discussion of, how we're going to handle contact tracing, how we're going to handle closure, how we're going to handle that 14-day quarantine and the 10-day sick window as described in the governor's plan. Let's not get too complicated right now. Let's use some common sense. Let's take a big step back. We first, like the CDC recommends, we first need to consider the activity of the virus in our community. We have to look at our transmission rates. We have to look at the rate of community spread. So right now we are seeing unacceptable rates of coronavirus transmission in our community.
And I think
so that's just step one.
Step one, and that drum has been beat for sure. And I think that everybody has heard that over and over again. At this point, I think it'd be highly unlikely that the governor doubles back and changes anything, don't you?
That's why I'm here. That's why I'm trying to talk to all my teacher friends. That's why I'm trying to that's why I'm trying.
Yeah.
That's why I'm trying.
Let's get back to the phone lines. Kim is on the line. Kim, thanks for being part of our show tonight. What's your question? Go ahead, Kim.
Hi.
Hi.
Oh, sorry.
That's okay.
Hey, okay. So I listened to the mayor of Nashville today, and I understand that some of the cases seem to be going down wearing our masks. But also we have to think of, they have also went back and kind of put some closures on the bars and lessened the gatherings, which could contribute to the cases going down, not just the mask, correct?
That would seem to make sense. Don't you agree, Dr. Bono?
Right. In several places, a mask mandate does tend to show some effect, potentially like 2-3 weeks after the mask mandate is instituted and hopefully adopted
And
by the
I think Kim was also asking about the closures. They must help as well.
Correct. You know, much like was recommended by the Dr. Burke's report delivered to Governor Lee, there was a strong recommendation to close bars. So that's been a part of the White House coronavirus task force recommendation is to close bars and issue a mask mandate.
Kim, is there more to your question?
Yes. Also, you know, with the schools going back, I mean, I know each district is doing what the district is doing. I just wish, as a whole, I guess as a state, I wish that the governor would say, hey, as a state, let's do all the same thing, to have everybody on the same page, doing the same thing at the same time, because it's just very confusing just with the COVID itself happening in our world today. It's confusing. And then when we send our kids back to school and every school district is doing something different, and then if a COVID case comes about, it could cause you to pull back and go online, and then it feels like a confusing mess. Instead of everybody on the same page at the same time doing it together.
Yeah.
Right.
I think you nailed it, Kim. Thank you so much for calling in.
Yeah.
Yes, thank you guys for listening.
Really,
thank you.
Sure. Go ahead, Dr. Bono.
Yeah, you really bring up some great points because, you know, we are all in this together. And, you know, if you're playing a football game, do you want to come up with 95 different battle plans or one unified approach, you know? So we do need a shared battle plan, and delegating leadership to individual counties and individual school systems is just a plain inefficient way of doing things. So, you know, whenever we have this infectious disease in our midst, you know, again, we are all interconnected by it. And, you know, our actions in Davidson County have effects on surrounding counties, and our surrounding counties have effects on us if we are all interconnected. And yes, indeed, we should unify, and we should lean on our state leadership to do better and change course at this very critical time in our coronavirus response.
Let's hop back to Joe. He is on the line, patiently waiting. Joe, good evening. Go ahead.
Yeah, you would think that they would open part of the state or part of the schools rather than trying to open them all at once. And then another thing that I wanted to bring up, if you look, there's a whistleblower in Florida. You can look it up on the internet. That is saying that the governor of Florida and the professionals down there are wanting the public officials, doctors and the people that are making these cases to look at their fudging the data. And it's being fudged by their dividing the number of tests into the amount of virus cases, and that's what's giving that low data, because they test people more than once. When they have the virus, then they test the same person several times, where if they were just testing the person once that has the virus, instead of dividing that by all the tests. And you look that whistleblower case up and you'll understand it, what they're saying. I'm no professional to understand, but I can tell when the data, and also it said in that article that several states were doing the same thing to please Trump and to please the governors, to make the data look lower, to keep the people, to get them to open up these schools and open up stuff. And if they don't tell the truth on the data, I'm surprised the news media hadn't jumped all over this. If they're not telling the public the truth, how can a mother and father send their child to school to die? And that's basically what's going to happen. The school buses, it will scatter like wildfire on those school buses and the transportation getting them to school, especially when it gets into the air conditioning system of the bus, and the buses are enclosed like they are. To start school during this hot weather when they have to use that air conditioning and not wait till later, or start part of the schools and see how that works out rather than starting them all at once, you're going to have a pandemic sure enough. Thank you for listening.
Joe,
Please look up that about Florida.
Okay, will do. Thank you, Joe, very much. Dr. Bono, you are a practicing physician here in Middle Tennessee. Since March, how many patients have you had with the coronavirus?
Oh, I don't know. I don't know, too many. That's the answer. So
I mean, we're talking 10, or we're talking 20? 5?
So number one, I practice outpatient internal medicine. So I'm not in the emergency room. I'm not in the ICU. When it comes to what I'm seeing, I'm not seeing the most critical of illness. I'm guessing. I feel like I shouldn't contribute to the misinformation of data being represented poorly, as our caller reference, but hundreds, maybe at the most.
Of your own personal patients?
I don't know.
Of your own personal patients?
Yeah.
Wow.
Yeah. It really, well, I should say, like, I know at least hundreds have been tested. The numbers coming back as far as, positives, I really don't know. I haven't kept count. Too many is the answer. So.
I'm just thinking about that. If you don't know the number of positives, that means they haven't been in your office seeking additional care because it hasn't been that severe. Is that a conclusion you can draw from that?
I think that the structure of my practice is that we're trying to keep a lot of the testing outside. In any case, probably not a. So yes, I have seen not severe cases in my office. I have seen in my practice, I have not seen as many severe cases because that's the way my practice is engineered. I don't work in the emergency room. I don't work in the ICU. I have had patients that were healthy that have gone on vacation and have picked up coronavirus and have died whenever they got back to Tennessee. And in terms of other harm, I've seen blood clot disorders result from coronavirus infection. So it's not just a simple cold. It's more of a, we're learning that this is more of a vascular phenomenon.
Mm-hmm. Mm-hmm. Okay. So we have to take another quick break. When we come back, hopefully we'll get to more callers. Stay with us.